I'm kind of just testing some technology here today. So just bear with me. I just thought I would pop into the group and see if I can also go live on YouTube simultaneously. That's the huge question that I have right now. And I thought, well, while I'm beyond boot camp. So some of you are asking about Beyond Boot Camp because it's part of the bunch of boot camps that I have. And when you go look at Crucial Concepts Bootcamp, it's going to ask you if you want to add Beyond Bootcamp to that. So I see that there's people watching, so I know it's live working somewhere. You guys, I'm basically doing this to test some technology, but I thought I would talk about something while I'm doing it. So if you want to put something in the chat, that helps me see if that feature is working, and let me know maybe where you're watching from, because that's my other big question, like, where are people watching from? Okay, so my attempt to stream into the Facebook group and on YouTube and my Facebook page. We'll see how it goes. So anyway, Beyond Bootcamp, if you are Crucial Concepts Bootcamp, you guys, that's the course that teaches you those core foundation concepts, and then Beyond Bootcamp dives into actual subject specific things. So I kind of wanted to show you how that works and what it's about. So Beyond Bootcamp, holy moly, I think it's working, you guys. I have never, ever in my life gotten any tech I've tried to use for my business to work on the first try. So I'm super excited. Okay, so in this first one, it's basic clinical skills, talking about, the 24-hour clock. It takes a little bit of practice. We do a little practice with that. I talk about the concept of, asepsis versus sterile. Taking a manual blood pressure, because that is a tough hands-on skill for students to learn. And then this one on interpreting lab values, you guys. Interpreting lab values is about 5,000 more things than just knowing what the normal level ranges are. It's more in how you approach your interpretation of them. So I talk about that, and we do a little practice with that. IV therapy, and then this simple little one, because students were having so much trouble drawing up meds into a syringe. So I was like, I'm just going to show them how to do it. So I have a quick little video on that. Okay. And then communication is the cornerstone. I'm telling you, like the backbone of your nursing. What's the word I'm using? Your nursing practice. So, here I am trying to get fancy and things are moving around on me. So receiving report, giving report, all of that stuff, really, really important. And we do some practice with that as well. And then diving into oxygen, the whole concept of oxygenation, oxygen delivery systems. Like when I was a student, I had no idea, you guys, which oxygen delivery system to reach for as a student. I was like, I don't know, the face mask. So yeah, we talk about that. We talk about kind of my approach to how I choose the oxygen delivery system that is best suited for the patient's needs. Michelle is on both. Awesome, Michelle. I cannot believe it's working. Cannot believe it's working. I'm so excited. I can't see it on YouTube, but I don't know. Maybe I'm just not in the right place. Who even knows? And then COPD. Now, you'll notice, you guys, that clearly not every topic about respiratory is on here. And that's because Beyond Bootcamp is something that I add to on a regular basis. So eventually it'll have everything in it. But for now, it has some core things, and then new topics are added every month. I'm looking at a process to speed that up a little bit. But the reason for that is because I didn't want to have to wait to provide you with help with your med-surg topics for the entire library of topics to be finished. So I thought, let's just get it out there. We'll deliver it as we go. And in exchange for that, you get it really, really, really cheap. Okay. The GI system, IBD and IBS. We talk about ostomies. And this is a really cool one. My good friend Karen, who does have an ostomy and has worked as an ostomy coach, does a beautiful presentation on caring for ostomies and just kind of like some of the bigger concerns that your patient, especially your patient with a new ostomy, would have. Peptic ulcer disease, GERD, pancreatitis, etc. And then in cardiovascular, this whole concept of perfusion is huge, you guys. coronary artery disease, which also dives into acute coronary syndrome and MI, and then peripheral arterial disease, chronic venous insufficiency. You have to be able to differentiate the differences between those things. Hypertension. And then we do a whole big thing on heart failure. And then I think the next lesson coming up in the cardiac section is rheumatic heart disease, that inflammatory heart. So that'll be a really, really good one. Hey, Michelle, who's watching it in multiple places, let me know if are you in the Facebook group or are you on the Straight A Nursing Facebook page? I'm just curious if it's in the group. And then there's another, Peyton is watching from YouTube, it looks like. And then Pam, I'm not sure where you're watching from. Are you on the group or the main page? Let me know, girl. All right. And then renal failure, overview of renal failure, all those, the general taking care of patients in renal failure kind of stuff. And then that's because, there's different kinds of renal failure. Obviously, there's renal injuries, there's renal disease, glomerulonephritis, nephrotic syndrome, all of that. A lot of those, the care surrounding that will be kind of generalized because the patient's having renal issues, right? But we will talk about a little bit of those specific conditions as well, along with dialysis. And then endocrine disorders. This one on Addison's and Cushing's is so good, you guys. The one on diabetes is too, but I did this one most recently, and I remember how awesome it is. You're in the Facebook group, Michelle. Okay, very interesting. Okay, you guys, I cannot believe the tech is working. And then on neuro, we have stroke, a whole bunch of stuff about stroke, Alzheimer's, and then Parkinson's will be coming soon for that as well. And then we have immunity, which is going to lay the groundwork for cancer, for HIV, for autoimmune disorders, all of that. So I know it's not super exciting, Immunity Foundation, but this would be a core one to watch if you really want to understand those other specific concepts. And then arterial blood gas analysis. Holy cow. This one is so good, you guys. I have to just pop in here and show it to you. Let me just click play. I'm going to turn this volume down. It's just like I go through a whole step of how to do it. We do lots of, practices with scenarios. This is Joe and here's his issue. And there's Linda and all of these things. So we talk about that. And there's a fantastic downloadable workbook with this. Okay, you guys. So basically, I just did this so that I could practice using this live stream software that I just bought. And I wanted to see if it worked. Okay, Pam's on the main page, but I didn't want to just have nothing to talk about. So I think Michelle's already in Beyond Bootcamp, but if you guys have any questions about it, I will provide the link to that so that you can go check it out. It's basically when you go to get into Crucial Concepts Bootcamp, it says, hey, do you want to add this on for a super cheap price? And it's just so, so cool. Okay, so I think that's it. I just wanted to test this out. Thank you. And if I can figure out how to stop the stream, I will. Hey, Michelle, a question for you. On YouTube, and Peyton, you're on YouTube as well. And let me see how many people are watching right now. 8. Okay. For anybody on YouTube, if you could type in the chat, like, how did you know it was live? Like, did you get a notification that says a channel you subscribe to is live? I just want to know how the process works so that I can let people know the best way to access it there. Basically for those people that aren't on the Facebook. Michelle says, I am, and it's a good review. Oh, yeah, absolutely. You got a YouTube notification, Peyton. Okay, how cool is that? Awesome. All right, well, I'll have to do more YouTube lives because apparently I am a tech genius and I got it figured out. All right, you guys, thanks for being my guinea pigs today. I hope you have a great day. And basically, I'm getting this all set up because I am going to be doing it's crazy. I'm going to be doing 35 days of live video coming up in July. And it's the nursing school mindset edit. And I can't wait for it. And it's going to be so amazing. So that's 35 days of me shifting your mindset about nursing school so that you can start the next semester super strong, super ready for anything, super on top of your game. So that's what I'm kind of like prepping for with this little technology test. So I will talk to you guys soon. Thank you so much for coming and helping me figure out that I got I got it to work. Hello. Super excited about that. Okay. Bye, everybody.